everybody, what's going on? This is Dr. Jeff C. May, and welcome to an episode of Doctor's Orders, advice you should actually take. Listen, in this episode, we are going to combat the real enemy. We are going to have an in-depth conversation in around what I truly believe is one of the key reasons, one of the soul at the foundational level causes of America's healthcare crisis. And so many people don't want to talk about crises. They just want to like sunshine and rainbows. Well, guess what? There's a problem. There's a massive problem in the United States. Now, there's multiple ones, but there's only a few of them that I think I can have an impact and a positive outcome on. And that's why we're talking about healthcare, because for the past 17 years, I've been a chiropractor in the natural healthcare space, and we've owned and operated, and I say we, that's me and all my personalities and my teams, my beautiful wife, all those people who have been along for the ride, is that the Natural Healthcare Center, Advantage Healthcare Center in Jordan, Minnesota, is one of the premier destinations in Southwest Minnesota for natural healthcare. And that's not to be braggadocious. It's not to be ego-driven. That's a fact. And one of the things I've learned in there is that not only is healthcare in America at a turning point and a crisis, and here's why I say that. All I need is one fact for that. Over 70% of the deaths in America are due to lifestyle disease. That means the choices that we make day in, day out, week in, week out, month in, month out, years and years at a time are killing us. People are not living their life expectancy because of the choices that they make. Now, if I were to ask somebody on their deathbed, it's like, hey, do you regret not making better choices? If you could, would you want to go back and make better choices? And guess what the answer is? Like in nearly every case, what would it be if I asked you that? What would it be if you were on your deathbed and you said, hey, you could have more time with your loved ones, you could have the opportunity to make more memories, pass along wisdom, do all those things. If you could go back and make better choices, is that something you would want to do? And hands down, people are going to say yes, unless they're just full of it and they don't want to tell you the truth. And so here's as we dive into this, because in previous episodes and previous years, I would speak about, we just take a pill for it. Like we're so addicted to medications. And yeah, medications are a problem. Look into the opioid crisis or painkillers or like just hands down, man, there have been so many failures when it comes to medications and lawsuits that you'll never hear about. Let's be real. There have been so many things settled outside of courts, billions and billions of dollars, vaccine injuries, all of these things that you never hear about because they've got their own court system, especially when it comes to vaccines. And so not jumping down that rabbit hole, just to be aware of some of these things, that maybe what you thought you knew is not accurate. And that's why we want to address these things. So if it's not big pharma, because we've said, well, big pharma, yeah, that's a big problem. But is it big pharma? Well, I don't think it is. Well, what are you saying, Dr. Jeff? Like, who's the culprit? What's going on here? What about big insurance, insurance covering all the things that seem to not work. So many times we get calls in around our office and say, hey, I can't be there unless insurance covers it. Well, I'm sorry, but listen, I don't take orders from an insurance company. That's why I'm not in network with insurances, because when the insurance company owns you and owns your paycheck, they own your advice, and they'll also own your results. And that's not why I became a doctor. That's not why I became an independent entrepreneur, practice owner. It is because I wanted to blaze my own trail, help people in ways that I knew I was gifted and able to do and serve in that fashion. So is it big insurance? No, I don't think it is. What about big food? What about the nutrition, the labeling, like all those things? Like, granted, there's a lot of problems, where we look at pesticides, we look at just fake foods, we look at seed oils, we look at all the crap that we eat and the consumption of how many calories we consume. Massive amounts of calories. So is it big food? And no, I don't think it is. Now, all three of those combined, big pharma, big insurance, and big food and drug administrations, like those are big issues, and they put up a good case. You know why? Because they speak to your comfort. They help you become complacent. They allow you to be comfortable in your complacency. Now, what am I really getting at? What's the real enemy here? It's apathy. It's apathy. The joke goes where a teacher was talking to their classroom, and they asked, hey, what's the difference between apathy and ignorance? And a couple of buddies in the back row, the troublemakers who were sitting in the back, one boy, kid looks over at the other one, boy, because it's always boys, right? But one boy looks at the other one, and he says, listen, I don't know and I don't care. And you see, that's the point. You see, ignorance is not knowing and apathy is not caring, even though you do know. And so much of my career has been built on education, like doing this podcast, doing the videos that we do, educational process, the day ones, the day twos in our office, the conversations we have in and around at the report view box. All of these things is educating people because we've been educated in such a way that creates the fact that if you're comfortable, if you have enough food to eat, a warm place to sleep at night, then you're healthy. As long as you don't have pain, you're healthy. And we do all these things in the pain medications to mask the symptoms. As long as you don't have a symptom, you're healthy. And that's what healthcare has screamed for so long, and especially the medical side of healthcare. Now, I'm not saying it's a direct intention of medicine, but yet as long as you're comfortable and outside the doctor's office, because our health is so jacked up by now. Think of the healthcare system. There's billboards. You drive down the highway, there's billboards on the side of the highway that says this many minutes to be seen at such and such emergency center. And a lot of times I drive by that, and guess what? If it's anywhere from 4 to 7 in the evening, it just says 99. You know why it says 99 minutes to be seen? Is because it doesn't go to 100. If it went to 100, it would say 999. It's because our healthcare system is so messed up that it's only in times of crisis do we ever reach out and seek help. You see, when you're under crisis, aka you have a symptom and it starts interfering with your life and your quality of life and your thoughts of future goals and all of those things, that's when we'll actually do something, because all of a sudden we care about it. We care about it now because our health is actually being taken from us, or we feel it's being taken from us, even though it's been leaking. It's kind of like having a water bucket. And instead of like a massive hole in the bottom of the water bucket, there's just a couple of pinholes in the side. And over time, it's like, oh man, I'll just do enough things to make me quote unquote feel better. We'll put some more water in the bucket, but slowly, inevitably, it's leaking out. And over time, by the choices that we're making, the lifestyle diseases, cancer, heart disease, diabetes, dementia, Alzheimer's, a lot of these lifestyle type of diseases, obesity, all of that are like more holes in the bucket, and it slowly leaks out. And it's not until that water level hits a crisis level that we actually go and we seek help. And you see, it's because we don't care. We don't care because we're able to get by. We're able to be comfortable while being complacent and just, oh man, if I could just put my feet up at the end of the day. I just want to, I work hard. My kids are running around. We got schedules. We got all those things. This time of year, we got graduation parties. We want to go camping. We want to do those things. And so-and-so's got a wedding. So-and-so's got 3 more graduations booked all on the same day. And little Johnny has a soccer game and a baseball game and a little flag football on the side. All these things. I just want to rest. And you see, it's not until our health starts to creep up and interfere with that over time you've leaked out so much water of the bucket that you say, I care now. I care. What do I need to do? Doctor, tell me, what do I need to do? And that's oftentimes when we first meet people in my office. And you know what? We meet them where they're at, and we say, hey, what do you want? Like, I know you have sciatica. You feel like you can't put your socks on in the morning, or you wake up every morning with a headache, and all those things really, really suck. But what do you want? What do you mean what I want? I want my headache to go away. I want my low back not to hurt. Yeah, I get that. I understand that's pain, but what's the problem underneath? You see, what are you able to do? Well, I can't ride my bikes with my kids. I can't play. I can't sleep at night. I'm late for work every morning because I'm sleeping in, hitting the snooze, and it hurts so bad. I'm going to lose my job. Okay, there's a problem. You see, now you care. Now you don't have room in your life for apathy. And you know what? For some people, you got to hit rock bottom. You got to get there. But ultimately, the point of this is starting to introduce the fact that apathy will kill you. Like, apathy is what's killing your dreams. It's not big pharma, it's not big insurance, and it's not big food industry. Although they placate to our needs of a human, of just being comfortable, just taking it easy. You know what I think about that? That sucks. Like, taking it easy sucks. Like, you need to understand that you are capable far beyond than you've ever given yourself credit. And 99 people out of 100 that come through my office, they have to relearn that. They have to relearn that their body was made to be healthy, that there's actually a system in place called their nervous system that controls and coordinates health. And if you're not actively helping your nervous system, supplements, chiropractic, movement, exercise, hydration, positive mental attitude. And that's just, it doesn't mean like, oh, everything's sunshine and rainbows. No, it's saying that no matter what's going to happen, I'm going to face it head on. And you look at those things and you start inch by inch, and then all of a sudden, yard by yard, you gain momentum. And that's what the Advantage Life is all about. And so we've dedicated ourselves to helping re-educate patients as they come in to a process that actually puts them in a position of power rather than a position of being a victim. And that apathy will always placate to your victim mentality, and it feels good for the short term, but it inevitably will ruin your sleep, and you know you can't put it off forever. In fact, it's like sweeping things under the rug. Eventually someone's going to look under the rug, and you start pushing things and stuffing things and stacking things under the rug. Eventually, you know what? All you got is a big pile of crap that eventually is going to spill out in every single area of your life, aka a panic attack, aka anxiety. All of a sudden, I don't know where this is coming from. I'm not sleeping very well. Doctor, you got to help me. Now I'm sick all the time. I just have no energy. I'm fatigued. I'm tired. And I can't quit smoking because then I'll gain weight and all of these things. Like all of these things come spilling out. And it doesn't matter if the number on the billboard says 0, you will not find health in a sick care system. We have a sick care system in place. Drugs and surgery work when it's emergency crisis care, but you'll never produce health from a sick care system strategy. You need a health care strategy, and that's what most people don't understand. They don't get because they're apathetic to the fact that it takes work. They don't care. They don't want to know. They don't want to put in the time, effort, and energy. They don't want to pay their dues, and the dues are due every day, right? It's like paying rent. Rent is due every day. You got to get a mental win, a spiritual win, and a physical win every single day. How do you do that? Well, we'll talk about it more in the future episodes. I don't like to get these too much longer than 12 to 15 minutes. I want to give you enough to think about and ask this very, very important question and say, where in your life have you been apathetic, where you just don't care and it involves your healthcare? It's that thing you've been putting off. Another way to ask this question is, what do you know you've been putting off lately that ultimately is destroying your health? Answer that question. That's your homework. And those are your doctor's orders.